Implants, nachos, and family dentisting fun. I am so excited to be talking to one of my mentors, someone I admire, someone who brings more fun to dentistry, teaches my favorite thing, dental implants, Dr. John Minchetti. We're going to hear from him for just in just a second. We are so lucky to be producing this with Dentist Job Connect. We are here to help you unlock more freedom as a practice owner and best of all, fewer hygiene checks. So, John, before I hear about you, just tell our audience, does it ever get easier to have a full contact arts and crafts project in your room going on and two hygienists who need checking at the exact same time? How do you manage that?
That's the most awesome thing in life.
Yeah.
And then having my hygienist give me that dirty look.
The eye roll. Yeah, no, the eye roll. You're going to spray it to get us
Whoa,
together.
really? Oh my
That's
God.
why
You
you
gotta
need an
love. Oh, I love this
associate.
picture, Paul. Oh my God, that is so awesome.
So we were at the AID. I was so impressed. Dr. Matt Young, our awesome friend, we started back in Carlsbad back in like the 2006 time. But just before we launched in all the things you do, I was so impressed by this AID meeting. They're a sponsor of our group. Tell us a little bit about what the AID means to you.
Well, the American Academy of Implant Dentistry is the organization of implant dentistry. Actually, they're celebrating their 75th anniversary this year at our annual meeting in Nashville,
I
Tennessee.
will be there. We're going to come and exhibit. It was so great.
Woo, woo. Yeah. So, boy, I got started early on in my career when I was doing implants. How the saying goes, implants were dangerous and sex was safe. So, but nowadays, now back then, the only organization around was the AID. It was the first one that brought implants to this country with the old subperiosteals, and it's been the leader in education and credentialing for the past 75 years. And that's where it stands. You got to be part of it. I think if you really want to be full swing as a general dentist, particularly in implant dentistry, you should be at least a member of the AID and then work on your credentialing.
And just to highlight for our members, that's great, Jen. There's different tracks, right? You can start as a newbie, you can be intermediate, you can do all in X's. You guys have tracks for wherever you want to take your education. Am I right in saying that?
Absolutely. The AID has a number of educational opportunities and they're there to help to guide you, from the basics. For a lot of doctors with the basics, they may want to just go onto their implant learning center that they developed, online schedule to start viewing and getting a taste of implants, become a member, get the journal, go to one of our meetings, get an experience, go to some of the district meetings, which are the
Yeah.
local meetings that happen a couple times a year, meet members, find out how they're getting involved. For someone who's a little bit more serious, might want to get into the comprehensive programs, such as
Yeah.
the AID Maxi courses. And we have many of them throughout the country, and those are going to afford you all the hours you need to get into the credentialing process. And then from there, you could take the live surgery courses and the more advanced courses.
Yeah, I love that, John. Well, thanks for sharing that. And we have some ways for you to connect. We're going to give him a course taught by Dr. Matt Young through Nachos. But I was lucky enough to work with my dad for 11 years. Sadly, he passed away in 2016, but it was so amazing to work with him. And what has it been like to work side by side with your daughter? I met her at the AID. I love the TikToks you do together. But just as a dad, as a dentist, what has it been like to work alongside your daughter?
It sucks. No, it's been so awesome. She's a talented person and a wonderful person, and we just have a great time. We're having fun, and she's learning from me, and certainly I'm learning from her. I mean, with all this digital and stuff, and CAD camming and scanning stuff. I mean, I go to her. Hey, how do you do this? She's click and paste much quicker than I can.
And that's awesome. What is your day to day practice like with her? You guys working the same days? Do you work different days? Where is your practice located? Even though I know you tell our audience about that.
Yeah, well, we have a general dental office. There's four of us in our office. I have a partner, Dr. Hong's been with me over 25 years. Dr. Diamore's been with me as an associate for 25 years. We have an orthodontist, and we have Dr. Karras who's been with me now for 4 years. And we all kind of work at different days, but we're all here at the same time. Of course, we
Nice.
overlap. We have a large practice here, and so I'm practically with her almost every day. Maybe there's one day I'm in the hospital residency program teaching, and another day she might be doing that. But we're in the office, so we do spend a bit of time. Not together. I may not see her the whole day if she's doing some stuff on patient, but yeah, we do
I
spend
I
quite a
used to
bit of
say
time.
that too. I think that was interesting. My dad and I would sometimes drive into the office and not talk again until the end of the day because what I share is Working and running a dental practice, John, is like running a circus where the animals don't try to eat you, just slowly annoy you to death. And it's very, very hard. And until you do it, you don't know. Now, tell us, you might have done it all through your career, John, but just the camaraderie of having other dentists in the practice with you. Let's say someone's a solo GP, they're thinking they're adding their first associate. Someone, has a partner and they want to bring someone on. What's the benefit of having more than one dentist with you doing your dentist thing each day?
Like I can't imagine doing it any other way now. But when I first worked, when I first had my practice, I was solo. I remember those days. I got a first associate. Then I did. Then I didn't have an associate. Then I got another associate. Never again. It's just
Yeah.
nothing like sharing. You got to be able, number one, just psychologically to talk to
Yeah.
someone of a peer about what's going on in your head with these patients. I mean, we
Yes.
love our patients, but like you said, you're right. It is like a circus sometimes. So you need to bounce off. Hey, am I taking the crazy pills or what? So
I-
just for that, and then besides that, sharing time, sharing emergencies, it's just so many benefits to having a partnership, and that's the growth of the field. You see it. I mean, the day
Yeah.
solo practitioner, it's hard because you can't be in the office, you can't attend to emergencies for your patients. Patients want things 24/7, and then also to the affordability of it. You get the sheer costs of things and overhead. So it just seems the way to go.
I love that, Sharon. What I've noticed is dentists who do implants as we move to it often have associates because they still need to offer the other procedures to their patients, and it's not practical or possible to do them yourself. So as you elevate yourself with a skill like implants, and that takes up more of your time, that doesn't mean people stop having class two challenges and other things. So you get to share in that. So we frequently find through Dentist Job Connect that implant oriented dentists are some of the first to say, "Hey, I need another dentist here to help me out." So thank you for sharing.
Very good point. Very
Um, Now, I love dental implants from back in my residency days, and I want to ask you about your residency too. But there's people will be watching this thinking, I do bread and butter dentistry. I do crowns, class twos. I make night guards. I restore implants. And I don't know if I want to add implant dentistry to my practice. Talk to that dentist about the benefits, whether it's financial, patient rewards, patient centered care. What would you say to someone saying, I'm thinking about adding implant dentistry, but I'm not so sure if it's worth it?
Yeah. Well, I think number one, the clinicians who are both placing and restoring, you have a better understanding of the treatment planning and the options for your patient. I think that's really where it starts because you start looking at things differently. You're not waiting for a specialist to tell you whether he could or couldn't do something.
Right.
You're the quarterback now of this patient. This is an option, or this bridge is not salvageable. This span is too big. This root canal is really not going to make it on this tooth. And so you start treatment planning better for your patients in your general practice. If the more skills you have with implant dentistry, expand your treatment planning, expand your comprehensive treatment, your prosthetic skills, because you just know more. And then you want to talk about financially with the surgery, not even so much for the financial, it's for the communication with your patients. They don't have to go
Yeah.
to a different office. They're going to go through with the treatment. Number one, sometimes as a referring doctor, you send them to someone they don't ever go. B, when they get there, they have a complaint about that receptionist or assistant that wasn't as nice as your Kelly or Sheila. And thirdly, it's too much money. They want to charge me. I feel
Yeah.
like you're ripping me off. And then the treatment just gets stopped. And now the whole trust
They
thing's
lose momentum. It's a momentum killer. And then I also think that when you do this and then you know it well, when you do need to refer to a specialist for something that's specialized, you can do it with real confidence. Like, hey, you're going to get a lateral window sinus lift. That's not something we do.
yes.
Remember we did your implant on the lower where there was plenty of bone, Mrs. Smith. Well, now we're going to partner. So that's where you can say, and one of my jokes, John, you can use this. The only thing patients hate more than going to a dentist is going to another dentist once they're at their dentist, right? And so I think that that's true, right?
That's
They
a
got
good
there.
one. I
Yeah.
love it.
So I think, and I also just personally, I just find implants very rewarding in the sense where you're making a tooth where there wasn't a tooth before. I am not clinically practicing right now, but during my career, I've been thanked 0 times for a class two composite, but many times people have given me some actual gratitude with their implant cases. So I think for the dentist morale, it's a big part of it.
I agree.
But when dentists get into services, and sometimes they do them with great intentions, it could be clear aligners, dental implants, cosmetic dentistry. they don't know which pitfalls to avoid. And in my GPR, I really learned what made a simple case, a medium case, a challenging case, and that guided me. And it's understandable for dentists to be confused. So, what mistakes do you see dentists making when they start this journey?
Yeah, absolutely. Well, first of all, you got to educate yourself well. So do invest the time. Don't just dabble in. It's kind of hard to dabbling like in TMJ too. It's like a hard thing.
Right. Yeah.
You know, you gotta
Yes.
you gotta go a little bit more. You gotta say, I'm gonna really invest the time to learn this, learn the treatment planning, learn the skills so I know what I'm doing. And then that's how you can evaluate your cases. Because if you start jumping into cases and you don't know how difficult they are, you're gonna get a bad taste or a complication, and then you're in hot water and you don't want to do it anymore.
Yeah, that's it. I used to give this example when I taught this lecture for years, and maybe you know enough of Philadelphia. I said, if you were starting driving and you started in a high school parking lot, you could do that. Then you move to a side street. But if you drive on Route 76, you were somewhere else. But if you don't hurt yourself, you give up. You wouldn't want to do it again. So the biggest mistake is if you get in over your head, maybe you get out of a jam, but then you say, oh, I don't want to do this. So I think you're so right in building your skill set with real building blocks is so key. And that's why the places like the AID help you see that. And this is not my quote, John, but it's like smart people learn from their own mistakes. Wise people learn from mistakes of others. So I'm sure there's plenty of people in the AID saying, hey, I got in over my head. You don't want to do that. Stay in an area that's safe. And, my mentor, I want to ask about your GPR. My mentor at my GPR, Dr. William Stewart, is totally responsible for me learning implants. And he framed it to us. He said, you do some pediatric patients, you refer some pediatric patients. You do some extractions, you refer. Why can't implants be the same way? And that program, we teach people to do implants, whether they want to go and do all on X's or just learn. So, kind of, what's your role in the residency, and how do implants play a role for these residents in, fulfilling their dental dreams, feeling like they can do it as an associate? Tell us a little about your residency program.
Yeah, absolutely. Yeah. Well, we have a GPR residency program here at Englewood Hospital. It's small. We have 4 residents. One of them stays on in a second year, so they get a second year training in advanced dentistry. And yeah, one of the integral parts, of course, we're doing a lot of restorative. They learn endo, they learn OS. I mean, the first couple of weeks you could just see, oh my God, I've never done this much extractions, or they
Yeah.
have to get in there and do it because there's no specialists there. They have to do it in that clinic. And of course, they have great, instructors that help them get through it. But as far as the implant training, they're lucky enough to be involved in a year-long maxi course program. We have them participate with that, so they're getting all the didactic, they're
That's
getting
awesome.
all the lectures and the hands-on with that, and then they can incorporate those skills with some hands-on training in the clinic. So we pick their cases, review the cases, and again, you're right. We don't want them to get into these all on fours right off the bat. They got to start getting into the simpler cases, the onesie twosies, or the extraction socket
Yeah.
grafting, and prep it. So, because that should be an important part of being a general dentist. You're right.
Right.
You're right. You don't have to do molar endos in your practice, but you can do anteriors for God's sakes for your patients. You know.
And I'm so with you. And that's, where people say, I think people sometimes, Kara, your example of Kara having more technology skills than you, people go, you have to know crown and bridge. And I go, how many bridges did you do last year, Dr. Smith? They said 1. I go, well, like, is that really a frequent thing? Why don't we take some of this learning and put it on, like you said, extraction, socket preservation, planning cases? I mean, that's where, you can start to build your own cases there. And I want to ask you next is that, but first I want to brag for a minute, John. So it was Sunday, and our 11-year-old girls basketball team, I'm the coach, we were down 14-4 at the half. And
Oh
we
my God.
came back and won 16-14. Okay. 16-14, a 12-0 run, almost never heard of before. But I've used this
That's awesome.
example. Thanks. I appreciate it. I've used this example of why it's so hard to be a dentist, because we can go onto a basketball court and shoot free throws, and we can pass, and we can miss shots and shoot air balls.
Right.
But where do you get to practice these skills in dentistry? It's very hard. But there are hands-on training courses. So kind of just use this moment to help our audience understand why you got to do more than just lecture. You got to put your hands on it, whether it's the basketball or the 15C blade. So talk to us about
I
that.
love that segue into this question. It's pretty
Thanks.
good.
Thanks.
So, Yeah, no, because it's tell, show, do. You gotta tell it, you gotta show it, and you can show the slides or you can show it live, it's even better. And once you start doing, that's the only way you're gonna learn. So, and doing hands-on is very important. So, as part of our courses, we always have tabletop hands-on. We even use the Zimmer Institute's
Yeah.
mannequin hands-on stuff. I know we were out there years ago out in
Yeah,
Carlsbad.
yeah, for sure.
Absolutely, early on when they developed these techniques. And then again, you know, cadaver courses. We were in cadaver courses. It's as
Yeah.
close as you can get to doing surgery on patients before you're doing the live surgery, and you can really see the anatomy and things like that. But it's so important to get that visualization and that tactile sense because how are you going to practice? It's like dental school. You got to do hands on.
A- And I love all of that. You also, the challenging part is you have to take it and bring it back to your office where the mentor may not be there. So you have to know how to troubleshoot. So, like, one time an implant is going to spin that you didn't anticipate. I had an implant once, drop well below where I wanted it placed, and I had to remove it like a root tip. And you need all these hands-on skill building activities so that you can get yourself out of trouble and also know where you're going. So I do think in general, and that's why I'm a big fan of GPRs, it's so hard. Like dentists have it tough. Where do we practice these skills, right? Like we're always in the game with the patient. So find these AID courses, these places where you can go and learn this. I mean, to me, a GPR is a year of paid hands-on CE training. What could be better than that?
Nothing. That was the best thing I ever did in my career. Absolutely.
Um, So the next thing I want to ask you is, I love this question that you had shared with us. The difference between say, "Oh, I just place implants," or "I have an implant practice," and I'm interested to hear your response. I actually have never thought of it this way, so I love the way you frame this here. What's the difference to you than someone who says, "Oh, I place implants," versus an implant practice?
Well, I think to have the implant practice, you have to really set your mind that we're going to really take this to another level. And what do we mean by that? You're going to incorporate the total philosophy that your office is comfortable. You first of all, you're doing enough that your staff is comfortable with this procedure. They understand the whole systems and the mindset of when patients call. This is the place to come for your
Right.
implant treatment. This is the doctor's credentialing to do this implant treatment. We do lots of this stuff. We will get you through because these are big cases. These are a lot of fee for service patients and they have high demand sometimes, a lot of aesthetics involved. So there's a lot of emotional stuff going on here. So the whole team has to be ready with systems in place from welcoming the patient to presenting cases to financing, things like
Yes.
that.
Yeah.
You can't even fool around with this. It's not like, oh, does your insurance cover this? Not really. This is really fee for service. And you have to have all the tools and the cherries financing and this financing and that stuff. And you got to be ready to handle it. And the staff's got to be experienced with, or at least trained and that post-operative talk, because you leave the room, they're talking to the staff.
Yes.
Hey,
Exactly. I
what's
always, I always
nice?
love them.
Hey,
It's
what
very,
really hurt, and if they've never seen it or been
yes.
told about it, they're like saying the wrong thing.
Our human brain we're so odd, right? Like I used to train my assistant. I mean, you're so spot on because I would give a, you could do an implant, you go bridge this, people do this, of it, and then they turn to my dental assistant and go, "What do you think? Is this guy telling the
What do
truth?"
you
Right?
think?
And I just think it's cool, but also kind of, like you said, crazy. So your team has to be totally on board with the language, the scripting. Oh, lots of people get this done here. We just had a patient here who was happy doing it. And I just think that is such a key part that building an implant practice is way flap. And actually, we have a surgical prosthodontist with us now, who's an amazing dentist. And, we get to offer the cases from the top to the single implant. The easiest part is placing the implant, right? It's setting up for the implant, getting the money for the implant, having all the stuff for the implant, having all the tools
Yeah,
for the implant. I mean, the easiest part is, making a flap, drilling in a straight direction, closing the flap. After you learn that, that's actually predictable. It's, how many times has anyone been running around 30 minutes for a surgery, say, "Where's that little tiny thing that was in the little tiny hole," right?
that's right. Where's
So,
that drill?
yes. And
3.2 drill. I need right
yeah,
now.
yes, exactly. So I love that, Sharon. I think that's a really key part. So now I think this is key. What's interesting is I believe dental schools should not only teach marketing, John, they should market themselves because dental schools should get patients in for students to get reps. One of the biggest problems I have with dental schools is people are paying $400,000 and they do 4 crowns. Why isn't the dental school marketing for patients to come in. So marketing is like this bad word where I say marketing brings you the opportunity to help people, right? That's all it does. And so dentists, though, they're worried about sounding salesy. Your team. So if you were someone's asked you how should they market without sounding too salesy, what advice would you give to them?
Well, you're basically talking to the patients like education wise, educating them on the procedures, and you're sharing stories about other patients that you've
Right.
treated. That's the best way they can relate. Oh, you're like this case, or you're like this other patient, or this is what we could do for you, or these are the choices. So that's not salesy at all. They may say, "Oh, I hear implants are expensive." Well, here's your other options, or you're going to be very unhappy with the denture. I can make a lot of my patients. I'll make you the denture. I know you're going to be miserable, but
Right.
we can go through it. And if they go through a treatment, whatever, I don't care about the money for that. I just want you to be happy. I'm not trying to oversell anything. In fact, I
Yeah.
find that I've gotten older, I try to undersell because it just sells itself.
Yeah. Yeah.
It's
Exactly.
like begging you. I want it. I'm like, okay, so why overdo it?
I
Why over
think I think your point about telling positive stories about other patients, making them feel normal for understanding it's a cost. I mean, we recently moved and we're getting furniture, and furniture is a wild cost. I was unfamiliar with the cost of a couch, John, right? And you can get a couch. Couches are like implants. You can get one, you can get a $5,000 couch or a $75,000 couch. So I
That's
need to be
crazy?
educated. But we have this person educating us. And
Yes.
while I am not a cheap person, I always just thought, why don't you just get a couch from one of these, big box couch places? He said, well, a lot of times those are not constructed well and they don't last. So he actually did a good job educating us because we wanted this couch to last longer. So we have the same job as the people who sell couches and cars, is to make them understand not only the value, but the impact on their lives. And my joke, I have another good joke for this, John. So do you ever have patients say to you, it's so hard to be a dentist. I don't know if I should get an implant. I might die soon, right? Now, right.
Oh, that's a good one.
But you
Yeah.
know what I
Very
say? I
good.
go, I see you going on a cruise. Why are you using death to get out of this bill? Right? The same person goes, I don't need, I go, you're using death to get out of a bill. And of course, I say this with care, right? I don't say it
Yeah.
flippantly,
Yeah.
but I always think it's just because they don't want to do it, right? Like,
Yeah.
and I had an office manager at one of the offices we bought once who said the greatest thing. So we bought this office of a dentist. Sadly, he was sick. We never met him, but they loved the office manager. And I was like in my early 30s. So these patients are 70. I'm in my 30s. So we would say something like, oh, this filling that, it has no white part, Mrs. Smith, just silver. It
Yeah.
would benefit from a crown. And go, I don't believe you. So they go up to the front desk, and our office manager there would say, don't you want to chew until you leave the planet? And I thought that was such a good line.
A
It
great
was it was just a shut them down, because he said these young guys aren't trying to steal your money, Millie. They're not trying to make it up.
Yeah,
And
I
don't
like
you want to
that
chew until you
one.
leave the planet? So I
That
thought
is
that was
so
good. Yeah.
nice.
So
Smooth.
feel free to we touched on the team playing a role in the practice. I would like to ask you to dive a little deeper. Let's talk about who's the team member presenting a fairly complex case with both cost and number of visits, right? So let's just say it's more than 2 implants on 19 and 20. Someone's going to get an immediate load case. They're going to have steps. Once the dentist is done describing the clinical treatment, who's that passed off to?
Well, to be honest, a lot of some of these bigger cases, I will actually talk to them about what needs to be done, and
I like that.
I'll give them a number, because I know if I do it through my financial, sometimes they'll come to me, "Hey, doctor, look at this." So I'm going to come up with a number. Once I come up with a number, that my financial will take over from there. This is how we're going to finance it. These
I
are
like
the
that.
options. Bada bada. This way, there's not too much back and forth. Like, oh, do I need this? Yeah,
Yeah.
you need this. Because maybe they don't need something. Maybe they decide, oh, they want to get some veneers with this, or they want to do some bonding, but you don't need that right now. Let's focus on your immediate needs.
I love that you tell the number and then you let the finance coordinator figure out how they're going
There
to
you
pay for it.
go.
I think it's a
There you
perfect handoff, because they also, at the end of the day, they don't look at the dentist as the normal person, and they do look at your team as normal people. And I have found that they're often willing to reveal things to the team that are important that they won't reveal to the dentist. And
Yeah.
then those things matter. It could be an expense for their child's college. It could be something happening with their personal life. And I think, I think actually they think the dentist is here to talk just about dentistry, and your financial coordinator has this magical opportunity to kind of talk to them as a real person. But
Yeah.
I like that you give the number, because I think sometimes if the financial coordinator has to give the number and how to pay for it, it's a lot. It's a lot of, like, we'll call it financial
Too much.
dropping, right? Like, hey, I have a
Too much.
paper here, $72,000, right? And you're out of the room. You've kind of left the bad news to
Right.
the financial.
And I sometimes I'd like to see the shock. If I give them a number
Yeah,
and I see the shock factor, and I say, and they're like, "Oh," occasionally they'll say, "Is that all?" Which is like, you got to be kidding me. They actually said that, but that's
yeah.
the occasion. A lot of times, whoa, 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 whoa. Well, if that's just not there, is that other option? Then we could talk about it because I don't want to get into this is what we decide. This is your treatment. Let's move forward.
Yeah, no, I like that. I think that's and you have to train for that, right? You have to train for these handoffs, just like you train for
Sure.
flaps. You have to train for these, and
For
oftentimes
sure.
they're more complex. How about if someone's saying, "I'm not someone who does surgery. I'm intimidated by surgery. Isn't this surgery? There's so much surgery." What would you say to that dentist?
Oh my gosh. So for the dentist, the implant surgeries, if you can do basic oral surgery, you could certainly do implant surgery. If you've never laid a flap, then you need to learn those techniques
Yeah.
also too with the implants, of course. But it's not any more sophisticated than oral surgery for sure.
Dude, I always say it's a reverse extraction. Patients go, "Oh my gosh, I can't get an implant. That's so complicated." I go, "Well, you got the tooth removed. It's actually less
Well,
traumatic than that."
yeah, when the patients ask for it, absolutely. It's just like
Yes.
this is not. It's not hard at all. It's surgical precision. It's so
Yeah.
much easier than the extraction. I hate to tell them that right before I'm about to take their tooth out, though.
Yeah. Right. Exactly. No, but I say it's a reverse extraction, and I think
Right.
and dentists have to think. I mean, in a lot of ways, it's just I've always described it as a giant post and core that's easier than doing it on a real tooth. Because if you drill a little off on a real tooth, it's perforated. If
That's
you
right.
you can make a hole in the bone. It could be the wrong starter spot. You can put a new starter spot, and the bone grows back. I don't think people give bone credit for how magical it is. Right?
You're absolutely right about that. That's how I teach the classes. Just redirect that thing. Get
Yeah.
rid
Yeah. Um, Now, for a dentist who's looking to really listen to this and say, "You guys have persuaded me. I want to get started," but now, like most dentists, they want to do it in a fast track way. What would you say is a smart first step to do that?
Well, I'd say contact the AID, or an organization, of course, or someone who like the dental implant starting out, whatever. Get into one of the courses, get into a basic course. If you want to get serious about it, take some type of continuum courses, because
Yeah,
continuum courses are important. So you get the same repetitive learning. Repetitive learning works the best. It's the
I'm so
temp
with you.
school. It's from grammar school all the way up. Repeat, repeat, repeat.
And
And
I will share, I'll share how I think it's changing. I feel like when we were younger, Dennis, we had a much more go figure it out factor, right? Oh, you take a course, go figure it out. Like we didn't have all this online connections.
oh my
We still
God.
had meetings. So how would you say education's changing? And I think for the better, but you can kind of with implant education.
Oh, yes, certainly you got online education. Combine that with the hands-on stuff, and then you're going to be right there for sure. It's so much easier. You could take online courses. It's a plethora of programs out there that you could choose from.
And I want to share, you missed out on the free dinner by Matt Young on the first night of the AID. I was at a table with all these AID members, Walter and all these people. And the camaraderie the group has created is amazing. So dentistry can be one of my lines is dentistry can be very lonely, even though you're surrounded by people all the time, because being the dentist can feel like you're on an island. And
Yeah.
I think that's just another big part to this online collaboration coupled with in-person meetings and hands-on stuff is just the perfect way to grow your career.
Oh, for sure. And the mentoring is and the camaraderie and sharing. It's just so great with the academy for sure. You just learn so many things in the hallways. You go to
Right.
read in the hallways, you'll learn 5 times more than you'll learn
I
from
always say
someone
that you
on
learn just as much or more off stage than you do on stage at any of these things. And both matter because on stage can be inspiring. You can see, oh
Yep.
my gosh, I didn't even know that was a possible. But then you're having coffee, wine at the gym, going to networking events, and more dentists should do that. I think, if I can be on my 48-year-old soapbox, and I know you're, a couple years older than me, we only had that and we had to go meet people and it
Yeah.
was magical. And
That's right.
now that just because there's online learning, don't not go to these AIDs and AGDs and ICOIs. I mean, for you as a professional, John, put the implant aside. What is the impact of being part of these organizations to you, just as a person, a professional, a leader? Put the flaps aside from it, but you've been a president of the AID. Talk to our audience about that.
Well, it's been an honor to serve so many people and to help so many people grow their career. I mean, that's basically what it's been about. It helped me grow my career, because you got the confidence. You worked hard to get the credentialing. You said, "Okay, I could do this. I know, I'm good." But now you proved it, and you go to these meetings. You have the same problems that the other guys have, so you're human, and you could see your skill set,
Yes.
and you could set. That's the whole thing about it. And then from there, I was lucky enough to be in positions where I could help other doctors grow their practices, grow their careers, change their family lives, to be honest.
I think the whole "this isn't only happening to me" thing is so magical at every part of your career, but especially at the beginning part.
Yep.
And "this only happening to me" can be I just had the fourth team member quit, or I'm don't even know what's happening with insurance. I'm producing all this money, and then someone says, that happened to me too a few years ago. Here's how I dealt with it, and that's the stuff that's like just so magical about that.
Yep.
I did really enjoy learning. Talk for a minute. AID has some professional credentialing, and I know implants is not a recognized specialty. Am I right with that? It's not
You
like
can have it.
perio.
No, you can. It's not under the ADA's credentialing, but if it is under the ABDS, which is American Board of Dental Specialties, and you are allowed to advertise as a diplomat in implant dentistry in over 25 states at this point.
And which is helpful for me to even understand because I was there. But this professional credentialing, what's the benefit of that? For people saying, "Oh, I'll just take 15 different courses. I can be good at it." I'm not saying it's bad, but why do I want to get myself credentialed
Well, I think
professionally?
it's important, number one, credentialing, because it'll push you to learn more. Personally, it will push you to learn more about medicine and systemic and pharmacology and all the things you really need to prepare for that exam. And as far as the surgical and prosthetic aspects, the treatment planning, and then again, it for the public. Now it's a way for you to stand out to the public to market yourself as someone who has more experience, because every Tom, Dick, and Harry says they do implants today. And so,
Right.
really, what separates you being a better clinician than them is a credential by far, for sure. And it is a public safety issue. So,
Yeah.
patients could know by public safety that this one's credentials, they've passed some type of rigorous bona fide examination.
I love that. You can highlight your own awesomeness and say, I put the time, the energy, the effort, be proud of it. And I think you're right. We're coming to a part of implant dentistry where it's like back to being a little bit of the Wild West to some degree with
Yeah,
like what
yeah.
people say they can do. And, oh, I'm going to get, what's interesting to me is if I said, "Hey, John, join me in Philadelphia, we're going to get the best cheesesteak that they have for $3. You'd say, I don't want a $3 cheesesteak, right? And for some reason with dentistry, sometimes I'm just going to use an example. Oh, I went to someone and they said I went to a specialist or a general dentist who does this. They said all on X is 30 grand, but I see someone advertising it for 7 grand. I don't know why they don't think that that's a red flag, right? I'm just using that and that's why I think this credentialing is key. A few more things before I wrap up. Our good friend, Dr. Matt Young, did a training video. If anybody would like to text implant to this number, 215-798-9897, you will get that training video for free to learn about improving aesthetic outcomes in the aesthetic zone. I love your website, John. What is implantdaddy.com?
Oh, wow, that came around. It was at a meeting once. One of my students gave a toast. She said, "Let you're a father to us," the way you taught us. And somebody yelled, "Who's your daddy?" And that became the implant daddy. So it's a way for us to share education. We have a website with all our courses on it, and our maxi courses, our review courses, our preps for the credentialing tests. That's what we're about. We're here to help and mentor and help patients or help our colleagues grow their implant practices.
Absolutely love it. Grab a photo of us, Haley. So a couple more things before we wrap up, John. I always end my interviews with this. And when did you graduate from dental school?
1982.
82, and I was 2002. And I always think that when people go to see courses and events, don't ask dentists if they're happy, right? Don't ask them, "Are you glad you did this?" Ask them, If you could think back on your career, what do you wish you did sooner? And I will go first. This is my answer all the time, John. I was very into learning about implants, taking CE, joining my father's practice. Actually, I paid consultants to come help us train as a team, how to talk to the patient, how to get along. But I really regret not looking at the numbers of my practice sooner. I did not look at the PPO adjustments. It wasn't until I met my amazing friend, Mark Costas, who's now a sponsor. We did not really look at the business of our practice well. And I regret that. I
Yeah.
wish I could go back in time and take some of that energy I put towards customer service, hospitality, and implants, and put a little bit on my business. If you think back over your career, if you could tap your younger self on the shoulder, what do you wish you did sooner or got involved with sooner and said, I wish I did this sooner? What would that be?
Oh my gosh. I don't know. I don't think I have too many regrets about my dental career for sure. And my family, I got started pretty
I'm thinking
soon.
about
My wife
think
was
about
pregnant.
implementation. Maybe you said you practiced alone and you had an
Oh, okay.
associate and then
Well,
you
that's
didn't have one. I'm kind of thinking of an implementation, not a regret. Like I
yeah,
wish
yeah.
I implemented this sooner in my career. It could be coaching, it could be team training, it could be more associates, anything that you would leave our audience with. Like, I wish I did this sooner in my
Yeah,
career.
I mean, I guess I could say that if I brought in the associates sooner, it might have been better because there was a time where I was by myself for a number of years. Probably was good. Um, yeah, that probably would be my stay. But for otherwise,
Yeah.
I think we're pretty much on track. I'd say if you're going to get into a discipline, though, get into it soon, like you said.
Yeah.
Get
Well,
into it.
I mean, I think that's a in and of itself. I think we always think, oh, later I'll do this thing. Later I'll train on occlusion. Later I'll train on
Yes.
implants. And I was just at an event in Chicago with Dr. Erin Elliott, and she said I would tell my younger self sooner. Don't make excuses that your kids need to see you. Don't. She goes, they probably could have used some time away from me, right? People say I can't take seed till my kids grow up. Well, your career will be done by then, right? So you have to figure out how to infuse it.
I
And my
know.
real last question is: you're so famous on TikTok. How does Kara get you to do all those TikToks? I see with wigs. Uh,
Ah,
has that been fun to do?
it's been so much fun. Oh my God. My wife says, stop making so many funny TikToks. No one's going to take you seriously. And then my
Oh,
daughter will go, what are you kidding? We're blowing up.
yes, yes. That's what you want. Dennis can have fun too. They
Yeah.
can show they're real people too. So I absolutely love that. Well, stick around for a minute, but thank you so much, John. You're just inspiring to me. I truly appreciate this time. We're going to
Ah,
share this with our audience and really appreciate it.
thank you, Paul, for having me, man. Keep it up.